Hi, Joelle. Thank you very much for being one of the Royals captains for the Staff's Run for Women program. And Joelle, what's your team's name?
Thank you so much for this opportunity. Our team's name is Run, Eat, Research, Repeat. That's been the former name, but we're currently working on a newer name to freshen it up a little bit.
Okay, and how long have you been doing this?
So I started with Run for Women for Mental Health with the Royal since they started. So I think that was in 2013. But as a Royal captain for 6 years now, this is the 6th year.
Oh, wow, that's amazing. Well, what inspires you to run for women?
Initially, I had always been wanting to join a run, and the opportunity just never came up until that the mental health for women came into play, and the Royal became part of the Run for Women. So that inspired me to start, and what kept me going is after that first race, that first run that we did with the Royal. I was inspired to become more of an advocate for women's mental health, to break the stigma that surrounds mental health in general, especially women's mental health. And from a community perspective as well, women are caregivers, and a lot of times we don't take time to take care of ourselves as well. And that is also an important thing to take in mind and to consider as well. And I feel like doing this run for women would help to put that into perspective. And from a research perspective, I like that we are putting research in the forefront at a community level, basically, because a lot of people don't realize how much research is involved in the development of therapeutics or pharmaceuticals. So there's a lot of research that needs to be taken into consideration, especially when we look back at the many years ago how a lot of research was done mostly on men. So that we don't face the confounding elements such as hormonal changes in the cycle of the women's hormonal cycle and so on. So we need to take into consideration this now so that we can get better outcomes from the future pharmaceuticals. Especially when we look at from a pharmaceutical perspective, in the past few years, there hasn't been that flagrant progress in pharmaceuticals targeting mental illness specifically, and specifically even more so in women. So allowing at a community level with our loved ones, our neighbors, our friends, individuals who are affected by mental illness. So having that run allows all of this to come into place.
Wonderful. I think what you're trying to say is that women are not small men.
No, exactly. We are women, and that should be celebrated.
And for those who haven't registered with the team yet, why would they consider joining your team? What's so awesome about your team?
Because we're researchers, and because we prioritize mental health, and because breakthroughs come with the help of everyone, research included. So it creates a wholesome approach this whole run, and yeah.
Well, that's wonderful. Thank you very much, Joelle, for all that you do to support Run for Women.
Oh, thank you.
All right, together we're unstoppable.